I'm Al McFarlane. I'm Al McFarlane. Welcome to Conversations with Al McFarlane. We attempted to present this video earlier today in our regular slot, but had some audio challenges. We think we fixed that, and we want to provide this program. The program is a recording of a neighborhood association that I normally moderate the monthly meeting. It's the Hawthorne Neighborhood Council. Hawthorne is a neighborhood right here in North Minneapolis. North Minneapolis is the sort of the oldest and largest, one of the oldest and largest Black communities in Minnesota. And it's a place that I live in and have lived in. It's where my newspaper business is located. And it's where over the years we've sort of seen ourselves as the seat of public policy. The earlier versions of this program were held live in a neighborhood restaurant called Lucille's Kitchen. And for a number of years, we had live audience programs that included guests like Paul Wellstone, like Jesse Jackson, like Al Sharpton, along with Minneapolis political and cultural leaders, the mayors of both Minneapolis and St. Paul, the governor, state of Minnesota, the neighborhood activists who challenged power at every level, educators, artists, singers, theater people, a lot of people. So we have been in this neighborhood promoting the idea of sharing and of being with each other with the eye towards how do we create communities at work. Well, Hawthorne Huddle represents one of the venues for that to happen here in Twin Cities, and I'm pleased to have the partnership with the Hawthorne Huddle, the Hawthorne Neighborhood Council. Its director, Diana Hawkins, who's normally here with me on Mondays to co-host this program. Well, last week, Thursday, was the annual, not the annual, but the monthly meeting of the Hawthorne Huddle. The huddle itself, Diane Hawkins started almost 28 years ago. She and some friends of hers in their living room said we should get together and address some of the problems and challenges in the heart of the Black community, the transitions. And they've been meeting ever since, being a place where the civic, the education, the public safety apparatus, institutions could gather, share notes, and engage with residents, community people, break bread, and talk about how we build community. Well, this meeting that you're going to see is a typical but excellent example of being in community. It starts off with a presentation by the acting director of the Minneapolis Health Department. We get a monthly update on COVID-19, its impact, its spread, efforts to reduce, resist, mitigate, on vaccine awareness and adoption, and that's a regular feature. Then after that, there's a report from the 4th Precinct, the police precinct that's centered in our community, and update on number of crimes and what kinds of crimes and what to watch out for, how to be safe in the neighborhood. The special presentation today is by a group associated with solar energy, renewable energy. And it's so important to me that our community, Black people, see ourselves as the environmentalists that we are, and see ourselves connected to technology that will shift the dependence from fossil fuels and extractive technologies that deserve the planet and deserve us. We are victims of coal burning and incinerators and garbage burning and technologies that leave lead and pollute our air and make it difficult for us in our neighborhoods to be healthy. So how do you address that? You take the time to learn and to explore and adopt technologies that are clean and technologies that actually provide opportunities for massive employment in our community, leadership in our community. Well, check this out. And as always, I invite you to like, share, tell people about this. We're here usually every day at 1 o'clock. Tomorrow at 1, I'm pleased to have Keith Ellison, Minnesota Attorney General, talking about the state and the Hennepin County attorney's decision not to charge officers associated with the killing of Amir Locke, who was killed by police in a no-knock raid in downtown Minneapolis. You don't want to miss that. Want to have your feedback, your story, your conversation, your ideas, your concerns. I'm Al McFarlane, so I'm going to start the program of the Hawthorne Huddle. Enjoy this. We'll see you tomorrow.
Good morning, everyone. I would like to officially welcome you to our Hawthorne Huddle meeting. We have some great presenters today. We have some great honorees today. And I just want to welcome everyone. We know it's chaos out here, so I'm just asking everyone to be cautious and to be safe. Ms. Ann, do you have anything that you want to add before we turn it over to Mr. Clarence? Oh, and by the way, our friend Mr. Al couldn't be with us today, but he will be playing this back later on.
Nothing to say, but thank you, Clarence, for stepping in. Really appreciate it.
Well, thank you. Thank you for the opportunity. So, Ms. Diana, maybe I should just go ahead?
Yes, sir.
Okay, that was my introduction. Okay, good morning, everybody. I thank you for joining us this morning. It's always great to start off the morning with a meeting. And it's always great to start off the morning with the meeting with the Hawthorne Huddle, because we know that the Huddle and the members of the Huddle are doing some really great work as it relates to our city. So I thank Diana for asking me to host the meeting, and Mr. McFarlane for allowing that to happen. And so we just want to thank you for being here. We also want to invite you to feel just to participate, because this is what this is about. So first, we're going to ask. I'm going to turn it back over to Ann, and Ann is going to introduce our Commissioner of Health for the City of Minneapolis.
Yes, I am. As many of you know, we have a COVID update every month during this time. And Louisa, who typically does it, is away taking her daughter to some college tours this week. So she's not going to be able to join us. But in her place, I'm very happy to introduce to you our interim Commissioner of Health, Heidi Ritchie. And I've had the opportunity to work with Heidi in a couple of capacities. She worked for Mayor Fry for a while, and now she's working as interim health commissioner. Last month, many of you remember that we gave an award to the Minneapolis Health Department for all of the work that they've been doing, particularly in COVID, but in many, many other ways too. So I'm glad to be able to introduce all of you to Commissioner Ritchie. And I understand that she's going to give us a little bit of a COVID update. So Commissioner, welcome.
Thank you so much, Ann. Good morning, everybody. I'm really happy to be here with you this morning, bright and early. I guess I'll just maybe start out with a little bit more about me. I've been with the city of Minneapolis for about 16 years. I worked for 8 years in the 9th Ward, so South Minneapolis area, and then worked for Council Member Fry before he became mayor. My background is in political science and international relations, and then I'm also a registered nurse with a public health nursing certification. So I've been working in the public health area for a while. For Mayor Fry, I was his policy director, so I held the portfolio of public health and also climate, environment, and sustainability, as well as leading the budget each year for the mayor's office. And then also leading the policy team. So all of the other portfolios fell fell under me. So now I'm over here in the Department of Health, and I'm thrilled to be in this new capacity, and just so happy to be able to be with you and continue all of the great work that the Minneapolis Health Department does, as you have all recognized. So with that, the COVID update. And so we've kind of started to pull back on some of our reporting just because we're getting less data from the state. And we've gotten some guidance from the CDC that helps us determine what our risk rate is. And so right now we can tell you that in the county, our risk rate is low at this moment. So that's good. We have seen really low rates of hospitalizations and community transmission. The last couple of weeks, we've seen it tick up a little bit. And I'm sure that you've heard about some of the high case transmissions over in Europe. So we're monitoring that very closely here as well. But right now we're seeing low rates, low transmission rates, lower hospitalizations. And so things are hopefully looking good. But like I said, we are monitoring a little bit of an uptick in case transmissions. I don't know what other information Louisa provides, but I'll be happy to take any questions about COVID or anything else.
I have a question, Heidi. We know that there's this BA2 out there, but I heard last night that there's another one called XE that just came out. Do you know anything about that?
Well, there's another variation like the B11, but the XE I haven't heard of, but that might be just another name, because sometimes they go from a variant to another name. So yeah, that one I don't think is a cause for concern at this point.
So
Thank you.
Commissioner, Commissioner, even though, we're talking about things waning, as a community, what should we still be vigilant about? I mean, I think that part of it is that, you hear the news, sometimes it's up, sometimes it's down. What are your suggestions for us as a community to make sure that we maximize our safety in spite of this good news?
Yeah, I mean, I think that respecting that everybody is in a different situation. And so I think taking precautions for yourself based on your own situation is good, but also understanding that not everybody is in the same situation as you. So taking those extra precautions as a way to keep other people safe as well is good. So still continuing to do the good hand hygiene and the safe distancing is still going to be important. Masking, especially if you're not vaccinated or you have immune conditions, or you're around people that are in that situation. I would say continue to stay vigilant with the safety precautions, because that's really the only way that we're going to be able to come out of it. And then, of course, the number one is vaccinations. And so really just make sure that you're up to date on your vaccinations. Because one of the things that we're seeing potentially in the United States is we had so many people infected with Omicron that might be the reason why we're not seeing an uptick like Europe is, because we've got some folks that have immunity after being infected. What we do know is that immunity does not stay around forever. And so that's why the vaccination is important. That's why being up to date on the vaccinations are important, because the vaccination immunity wanes as well. So just being up to date on those vaccinations, and then making sure you're taking those same precautions that we've been taking for 2 years, especially if you've got immunocompromised conditions or you're around people that are immunocompromised.
Which gets me to my second question, which is, I think now we're on our fourth booster shot. How many more are we going to go?
I think that's a great question. And if I had my magic 8-ball here, or I had my direct line to the CDC, I might be able to tell you, but it really does depend on what your personal condition is. So, you know, with the fourth shot, that's being recommended for folks who are over the age of 65 or immunocompromised. And so I think we'll see, as you know, as vaccination, more research, more data comes out about how long vaccination lasts and how, you know, the vaccinations differ when they come out. I think we'll have more information about that, like I said, as the research comes out.
Thank you for that answer. Does anybody else have another question for Commissioner Ritchie? Well, then, hearing none, I just want to once again congratulate you and thank you for being a part of our Hawthorne Huddle today. And we definitely look forward to working with you in the future. And we just love working with Suzanne. I know she's on the line as well. So thank you again.
Yeah. Yep. Suzanne is amazing. I'm going to put my email address in the chat. And if you think of any questions or you need anything anytime, please reach out to me.
Great. Thank you again.
Thank you, Commissioner. Appreciate your being here this early in the morning.
Thank you.
So next we have Bill Magnuson, who's going to give us a safety report. Bill?
Thank you, Mr. Jones. Welcome, everyone. Good morning. Before I start in the safety report, I do want to personally thank the Hawthorne Neighborhood Council. Recently, this last month, as most of you might know, North Point Health over in North Minneapolis has a food drive every March every year, and they partner with the Minneapolis Police Smart 4th Precinct as a donation drop-off site. And so I was one of the point persons on this project for North Point. Shared the information with some of our community partners out there, the neighborhood organizations that we were accepting donations. And the Hawthorne Neighborhood Council, Diane Hawkins, was one of the first ones to contact me with donations. So I just first want to thank Diane and the Hawthorne Neighborhood Council for their partnership and for their generous donation to North Point's food drive. So thank you, Diane. Just getting started with the safety report. For part 1 crimes, I'm going to remind everybody what a part 1 crime is anytime that there's a victim involved and that's traumatized or affected by crime. For Hawthorne, for March, there was 0 homicides. There was 2 rapes, 5 robberies, 14 aggravated assaults, 4 burglaries, 11 thefts, 11 auto thefts, 0 arsons for a total of 47 Part 1 crimes from March. I do think there was a slight increase coming up from February, and I think that has to do with warmer weather. And I also unfortunately think that part of that is related to the teachers' strike that affected kids not being in school. So now that they're back in school, I hope that like to see a little downtrend on that. And I think that the biggest increase is probably in auto thefts. And I believe that has a lot to do with those open ignition ones. And I think we'll see as the warmer weather, comes up and people aren't warming up their cars, that's going to go down as well. But we had a total of 47, and hopefully we can get on top of that and work towards get the decrease in that in the next coming months. Does anybody have any questions? All right. Thank you. I'll turn it back over to Mr. Jones.
Thank you. Thank you, Bill. I am going to be right now giving an update for the Human report. And once again, I want to say I thank Hawthorne for the privilege of working with them. There has been, whether you know this or not, there's been a lot of things that have happened as a result of the great partnership that we have with Hawthorne. And I just want to share some things with you. I'm going to be really quick about them, but there are some really strong connections, and there are people from around the country that wants to connect with Hawthorne and the work that's happening. So we'll continue to talk about that. So there are about 5 or 6 things I want to share with you that is happening right now. Number one, we are in the process of doing a perception of vaccine hesitancy survey. It's a NIH survey that we're working with the University of Minnesota, and we're asking about people's perception about the survey about vaccines. We know that, for example, in North Minneapolis, someone was saying, Dr. Kevin Gilliam was saying that only about 52% of the people that are in North Minneapolis have been vaccinated, which means that about 48% that have not been. And then I think another part of the city, it was like 56%. So we know that there's a lot of people that are not being vaccinated. And so we want to have an idea about why people either are being vaccinated or they're not being vaccinated, and what are their perceptions about it. And so we will be doing some surveys. We're going to be sending out some requests for people to fill out the surveys. The second part about this is that when they gave us the surveys to do, I noticed that there was not any space in there for young people. And one of the things that I know about some of these issues that are happening in our community, young people have an opinion. And so while we do not have a IRB for young people, we still plan on taking some information and doing a community dissemination to talk about what are young people thinking about vaccinations. We know that there has been a recent concerns about young people and this particular issue. So we as a community are thinking about, how then do we address this? What information will people need? The commissioner was just saying that, we hope more people get vaccinated. Well, as a community, we have the opportunity now to not only gather information, but also to disseminate information about what people are really, really thinking about this whole issue around vaccination. The second piece is that recently we were invited to Cincinnati to go to be a part of a gun violence conference. And so we took some people from Minneapolis to Cincinnati to talk about it. And so we're coming back now because we know that gun violence is an issue, and we're going to collect information, and we're going to be doing projects. In fact, one of the events that's happening as a result of the leadership grant that we got from the city of Minneapolis, we'll be working with Can Do, and there's a 3-on-3 gun violence. Don't shoot guns, shoot hoops. That's going to be happening on Saturday and Sunday, and Hawthorne is a part of that. Hawthorne has been a part of that. So we're working across the city in terms of trying to address these issues. Then we have continued to do the Narcan distribution. Actually have had some people go out up to the drugstore on the corner of Broadway. We're passing out Narcan. We're making getting information out to the community. So we continue to do that as we work on education in the community around Narcan and about the importance of and the resources that are available for our community as it relates to addressing this particular issue. Some of you also know that recently we worked with the state of Minnesota on a brochure around infant mortality, not infant mortality, but on substance abuse during pregnancy. And so that particular brochure has been created, but it's also been created in Spanish and in Somali. So we are also reaching out to other neighborhoods to give them the information so that they can also share with their communities this about this particular issue. Once again, as substance abuse is an issue that Hawthorne has taken on, but as you can see there, it's starting to expand, and other people are starting to ask us to be a part of what they're doing. The other things that I want to share with you that we are working on and are involved in is there's a survey around strokes. There's a survey around diabetes, and then there's one that we're working with the University of Minnesota around healthy brain development for those who are seniors above 60. So there's a lot of things that are happening with Hawthorne that we are involved in, and it's really great for me as human to be a part of an organization, part of a neighborhood that is really trying to really create great public health services. And so I just want to just say these are some of the things that Hawthorne is involved in. And if you have any questions, Diana will be more than happy to answer them for you. But right now, I just want to open up the forum. If you have any questions for me, I would be more than happy to answer them for you as well.
They can always put them in the chat too as well.
Put them in the chat if you like to.
Yeah.
Okay. So Heidi just said that there's 59.2 fully vaccinated in 55411. So that number has gone up.
Okay.
So we're excited about that. I mean, we're happy about that. Any other questions for me or thoughts? I just want you to know that I'm extremely proud and happy. Human is extremely proud and happy to be a part of Hawthorne. And we will continue to work and do everything that we can in order to make our communities healthier. And so we also look to work with other communities as well.
Mm-hmm.
Okay.
I just want to ask you this, Mr. Jones, you were working very hard on a whole bunch of things.
Mm-hmm.
Are you getting some rest? You're really on it on all kinds of fronts. I just want to
Yeah.
make sure you're taking care of yourself.
Yeah. Well, interesting enough, one of the, I believe in working smart, not hard. And so I find good partners to work with. Okay. Just so you know that I'm not, and one of the things about us, we do a lot of stuff, but I don't have to be out front. See, that's why I can always say, okay, well, Diana, you do this, I can say, Sam, you do this, or I can say, we do a lot of stuff, but I don't have to be out front, and I don't want to be out front. I just want to get it done. And I
Right.
think that there are some really great treasures. I mean, I think my personal philosophy is this: there's some really great treasures in our community that are really doing good work, and
Mhm.
they are the ones that need to be promoted.
Yeah.
And it's important for us as a community to be able to do that and to be okay with that. I always tell people, we're not competitors. You know, this is our community. We need our families healthy, and so if you're the person that should be taking the lead, I don't have any problems with that whatsoever. I'm not gonna lose my reward. Okay, what I'm trying to do is I'm trying to find the allies. I always say this: you ain't got to be my friend, but can we be allies? You know what I'm saying?
Mhm.
And I ain't a hater. I will promote you. I will promote you. I will promote you. I don't care. The bottom line for me, and I think this is why I like Diane and I like Hawthorne. The bottom line for us is that we have a healthy community. That's it. You know what I mean? And we all benefit when we create these win-win situations. I think, even in terms of, you know, it's so that's my personal philosophy. I know this is not about Clarence, but this is about how we've been able to really, really work with Hawthorne. Hawthorne is doing some really, really phenomenal things. In fact, we were just talking recently. I know Karen and Robin and Dinah will talk about this. We've had about, I don't know, about 5 papers printed. I mean, recently, uh, 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 scientific journal papers printed that Hawthorne has had that was involved in. I mean, so I mean, there's a lot of stuff that's going on that maybe you don't know, but Diana will tell you.
That
Okay.
is it. That is the secret of good leadership, Clarence,
Yeah.
that you just defined. Thanks for
Yeah.
doing that.
Well, thank you. I am getting my rest.
Good. There's a
Okay.
question here. The
Okay.
question from Grace is, who are you working with on vaccine hesitancy survey at the U of M?
I'm working with Dr. Mickey Eaters, and yeah, so Dr. Mickey Eater, and I think Karen and Robin can tell you more about his credentials and stuff like that. But we've been working with him. We've been working with them for
Years.
4 or 5 years. For 4 or 5
Yeah.
years, right? But if you want to know more, you want to be involved, please let us know. I
Mhm.
would I would love to have more participants. We're supposed to get 900 surveys, probably in the next 5 months. And so as much as we can get, and again, I have had people tell me like, I know I'm talking too much, but anyway, I've had people tell me, people give me the information first, and then I hang up, and then 5, 10 minutes later they'll call me back. They want to talk some more about this whole issue because people are being affected by this, but people don't have the opportunity to share this information. That's really what we're trying to capture. We're trying to capture what is the narrative that's happening with people around us. People are being affected by death. People are we talked about some people are not being vaccinated, and they don't understand the dangers that they're having to themselves and to their families. We just need to talk. You know, I'm not, again, I'm not trying to run anybody's life, but I'm just trying to say that as a community, we have the responsibility to have accurate and appropriate conversations about these issues. And COVID is a major issue as well as substance abuse. And so that's what we want to do. So thank you. And with that,
I'm up. I guess I'm up, huh? This
you
is
are,
my favorite part of the show. To be respectful of the people that we honor, I ask everyone to turn your camera on so we can see your lovely face. Because when we honor people every month, these are people that have been out in the community working hard, who has made a difference in people's lives one way or another. And I mean, you know, with the way we work nowadays, a lot of this is not seen. So we have to take the initiative and honor our colleagues. And I think, Clarence, you are up with the first honoree, or Ann.
Ann is up first.
Okay, Miss Ann, take it away.
Got it. I'm going to turn on our screen share so we can all see what we're talking about here. So I have the opportunity of working with some really wonderful people at the Youth Coordinating Board. And what Clarence just talked about how there are gems and how there are people who do great work. And that as a leader, really our job is partly to help people be out in front doing the work that needs to be done, because there are lots of people who can do it. I've had the pleasure of working with Latoya Balagoon since I came to the Youth Coordinating Board, and I think in 2008. And she started out as working on our Youth Are Here circulator bus. Here's her award. This is probably the picture you're going to get to see of Latoya. And then she started working on our downtown outreach team, and she was working with our Youth Congress. And several years ago, I was able to put her in the position of Director of Youth Engagement at the Youth Coordinating Board. Latoya has done a wonderful job. She exemplifies youth worker, I'll tell you that right now. And the outreach teams that she's been able to manage have gotten a great deal of they've gotten awards, they've gotten congratulations, they've gotten comments. The most important comment is when people like the police say, is the outreach team going to be there? Because we would be better off if they are there. And so Latoya has led all of those efforts. The most recent one I want to say is that she is putting together a youth outreach manual that will be able to be used by everybody around the country. And it's a really, really good piece of work. And we're getting ready to do a youth congress manual too. So it is my great pleasure to present this award of appreciation to Latoya Balagoon, someone who's been out there working hard in the community for a long time and who doesn't require a lot of recognition. So it's always nice to give recognition to somebody who's a gem, who is just doing the work every single day. So Latoya, thank you. And I think you get to say a few words.
Well, I'll try to keep this succinct. Thank you all. I'm very honored to be in this space with you all this morning and also to be included in this wonderful group group of honorees. I can say, at least for Sam Simmons, I've had the opportunity to sit in some of his training, so it's really wonderful to be a part of this group in particular. Really, I want to say thank you to the team who has really made this work happen. Ann knows that I'm an introvert, and so I typically like being behind the scenes, except when I'm working with young people who just bring something out of me, and I'm able to stand in front of them in a different space and really engage and interact with them. But for this work in regards to directing the outreach team, I don't think that it will be possible without the people who do the work day to day, but then also the support from the community. And so thank you again. I'm honored to be here. And I just want to quickly shout out some of the outreach team members. So Byron, Mark Woods, Roy, James Mullins, Daciana. Again, just a few of the folks that I've had an opportunity to work very closely with. I'm grateful for their continued trust in me and my leadership. And again, thank you all. And I appreciate your time.
Thanks, LaToya. All right.
I think Clarence is up now. You're on mute, Clarence.
I'm sorry. I got so excited I forgot about it. I don't want to sound morbid, but I have the opportunity to present Mr. Sam Simmons. Now, I'm going to tell you a story. As I've become more seasoned, you know, I think about, you know, that transition to that next world. My wife asked me, who did I want to speak at my funeral? And one of the people that I selected was Sam. It's only going to be two people. And Sam Simmons is going to be one of them. And I'm going to ask Sam, I think Sam has been a phenomenal community partner. He has been a treasure. He has done a lot of things for the community without people knowing it. He has been behind the scenes. I love having Sam in a room, and I just say, Sam, what do you think? And if you know Sam, you know Sam's going to come up with some gems. But I'm very honored that we are honoring Sam Simmons, and we're going to ask Sam to have a few words. Because y'all know Sam. But I have a great deal of respect for the man, and I think that he is a treasure for our community. So Sam, would you go take it away? Thank you. I said all those good things about him. He's not here.
Yeah, I'm here. Yeah, I'm here. I was just trying to take it in, you know. You said all those good things about me because you want me to act right. I don't know what that's all about, but I'm not. Let me see how do I put this. I am not surprised often, but I was quite surprised by this. You know, I know that I've done things with Hawthorne off and on at different times when I've been called for. So you don't, when you do things like that, you don't think about what kind of awards you're going to get, and because I don't make it to all these early morning meetings because I'm not an early morning guy. I keep track of them and those kind of things. But I call myself the backdoor man, even though I'm not that any longer because too many people know me. But I don't need to be out front. Like, some folks need to be out front, need to be seen, need to be heard. The thing is I like the part of being heard, but I want to say something that's going to leave folks with some thoughts and understanding to do their lives better. And I too am honored to be honored on this day with Latoya, because I remember when she started back with the group, and I remember her sitting in, as we say, in the cut, when all the over the top personalities would try to drown her out and that kind of stuff. And it's important. You don't always have to speak, but when you do speak, you want to be heard, and that is her. And so I think this is like a great day, because you have two ends of the spectrum of our community in terms of generational leadership, and I wish to continue to support Hawthorne Huddle, and I am honored with this award, and I want to thank you, and I appreciate it.
You're welcome, Sam. You're very welcome. Well, it's my turn. And you know how I tell you guys, this huddle is my family. This next family that I'm going to honor really is my family. I can't tell you enough or say enough great accolades about the Baylors and McDonald's. Doris gave my daughter her first job for the, it was a program. I forget the name of the program. When she come on, she'll talk about it. But I too work at McDonald's. And for somebody to tell me you have a lifetime job, you know that's a family. And I just can't say enough about this family, because they look out for the community. They hire from within the community. They do things in the community that don't get noticed, but it should. And I mean, I just can't say enough. Justin and I have sat on boards together. Tim and I have sat on boards together. So when I say that this is a family that you really can depend on, this is that family. And if anybody knows anything about the Baylors, they are a good family. I can't leave out their daughter and my grannies, the babies, so I can't leave them out. But with that being said, Miss Doris, you can please say a few words for us, because I don't want to cry. I know she's here. She must be muted.
I'm trying not to be. Good morning. Can you hear me?
Yes, we can hear you. You're muted, Doris. You're still muted.
I'm sorry. I thought I had unmuted. What about now?
There you go.
Okay, great. Good morning. I appreciate the wonderful words of encouragement and acknowledgement. It's a pleasure to be here. I know the Hawthorne Huddle and the wonderful work in the community that is highlighted on this platform, and so I'm really honored. When I was working at the Y, the program that Diana was speaking of, it's called Beacons of Hope, and it was around youth development and leadership, and it was a life-changing experience for me in the community. So much, in fact, that we not only worked here, but we also moved here. Our first restaurant, McDonald's, is located here, and it continues to be a beacon in the community, because I took what I learned in that trading at the Y into the restaurant. And Diana is right. We created a community of family members who care about Hawthorne and Minneapolis. So thank you so much for this honor. Justin, Tim, and I are truly humbled and appreciative of your wonderful care and support. It's been a joy. For the last 25 years, we have served breakfast, lunch, and dinner in this community with joy.
Thank you, Doris. Mr. Clarence, I'm gonna turn it back over to you for the main topic.
I'm sorry. You know what I was going to do? I was going to ask you to introduce our guest today, Karen and Dr. Karen and Dr. Robin from the University of Minnesota, because Diana, you have been working really, really hard. And I think people need to understand the work that has been occurring in Hawthorne, and I think you're probably one of the best presenters that we can have to introduce them. I do love them, but I think it's your turn.
Oh, wow. Okay. Well, let me guys first tell you about Dr. Karen and Miss Robin. I first met them at a PICA meeting. This was my very first meeting when we joined He-Man about 4 or 5 years ago. And ever since, we've been working hard. And every one of you that is on this call, that is a part of the coalition, these two ladies right here made what we were doing in those early meetings of the coalition come to light. This is where these papers come in. Bill, we love you for giving us the statistics. I mean, people, it's out there. So every one of you that is part of the coalition has something to do with this presentation that these two ladies are going to make today. And I even get to speak. So without further ado, Ms. Robin and Dr. Karen, take it away.
Thank you so much, Diana. You know, I am just so full of appreciation for this group, having had the experience of joining you for all these years, but this morning, I mean, I'm starting my day in the best possible way, full of your joy and your shared passion and your efforts together in community. And what a privilege it is to be with you and to share in this. I just wanted to set a little context before Robin. Go ahead and share those slides, Robin, because I know we have to go quickly. I just want to say that you've heard a lot about surveys already today. And we're going to talk about another survey, but ours is a little bit different because the purpose of this survey is to provide Hawthorne with the data that Hawthorne can use. We don't have an agenda. We don't have a research project that we want to publish. We have a way to give data back to community, and I think it's a goal of I'm sure every single person that you partner with that Hawthorne benefits, right? But in this case, you're the leaders. You're the ones who make the decisions about how you want to use our work. And we're here to support that and to help you make sense of it and to do what you want to throughout the process. So just really excited to be here, and I'll hand it over to Robin.
Great, thank you so much. I echo what Karen has said about so grateful to be here and for our work that we've done throughout the last few years. Just really truly honored to see how it continues to grow and flourish, and really excited to continue to move forward. So really appreciate being here this morning. We're going to share our presentation here. Let me see if I can. We'd like to first acknowledge all of the contributions and our partners throughout the last few years. And just we've had, obviously with COVID, we've had to pivot quite a bit to Zoom meetings, but we've really tried to make the most of it and continue, even though we've been, again, social distance and things like that, but we've really been able to move forward with a lot of this work. So again, thank you to Hawthorne Huddle, Clarence Human Partnership, Al McFarlane, PICA, Turning Point, and others as well. Karen, do you have anything to add to this?
Nope.
Okay, thanks. Again, just another special shout out to Al McFarlane, and really our gratitude for being able to air this on your show. Another way to kind of continue to get our information out, and all the work that's being done across our community. Just really, really quite thankful. So for our presentation, we're going to be sharing what's called My Strengths, My Health. We talked about a survey, but this is one way to really be able to use a whole person approach to gaining information and data from a community. It's really community informed and developed. It's a whole person approach, as I said, really trying to use the data to give back and have this data for community to have interpretation and conversation and a really dialogue starter as well. We'll talk about some of the data and what it looks like in the app itself, and then give a community example from some of our work the last couple of years. So I wanted to kind of start with this, this slide showing that My Strengths, My Health, our survey tool that we've been using, really does directly align with what we've been calling the social determinants of health. And that's a really big topic out in communities, and really understanding that it's not just our physical or physiological health, but really truly it is more about that. It's more about the environments that we live, our psychosocial, mental health, well-being, and our health behaviors that really shape our entire health. And so how do we bring those aspects and facets into the clinical conversation or into community conversations, and understanding that there's more to our health and healthcare than what we see, what we might go to a clinic or our provider visits. And so that's really just showing that how we can have data to talk about that and show that. So Diana, I'll have you speak to this slide.
Yes, ma'am. So what we did, I kind of said it earlier, you know, we took this out to the community and we spoke to them about various topics, and they came to the coalition. And so we kind of were building community trust. But the biggest piece for us was, it wasn't what do we want versus what do they want. And that was the key, finding out what people really wanted. We could have told them anything and rattled on, but give us your true feelings. Let's put your feelings into the survey and see how we did. So we did that through several platforms, health fairs, the coalition, Insight, the huddle, and then we had community engagement sessions. So the real key piece was, what did they want versus what we want? And as you can see, we had youth involved. had town hall meetings. So it really worked to just be able to talk to people about how they wanted to be involved. Ms. Robin?
Great, thank you. So when we talk about My Strengths, My Health, what is it? It is an application that Dr. Munson and I had created, but with community. So we developed and tested this with community. We took the instrument back out to the community to talk about the terms within the application. Are they, are they appropriate? Are they what people would want to hear or talk about when they talk about health and healthcare? Currently, our app is in multiple languages. We have it at the 5th grade reading level. It's freely available for clinicians and researchers, and it's web-based, so it could be used on a phone, a tablet, a computer, and such. So looking at the terms within the app, just to give an example that we have, again, we talked about whole person health, and so we have our app around these, what we call 4 domains or 4 aspects of health and healthcare. So we talk about My Living, which is the environment in which we live. My Mind and Networks, which is our psychosocial connections with community, faith-based, emotions or mental health, caretaking and parenting. My Body, which is our physiological health, and then also My Self-Care, which is our health behaviors. And we called out a few of these specifically kind of concepts or terms within the application around housing, COVID-19 specifically around breathing or respiration, but also infections, and then looking specifically closely at health behaviors. We looked at healthcare. So we'll take a closer look at what that might look like in the application or in the survey itself. So here's what it would look like if you're looking at the specific concept of healthcare. And so we ask individuals, this is a self-reported tool, so we ask individuals to report, do any of these challenges within healthcare concept apply to you? They're able to say yes, no, all of them, or none of them. Then we're asking if they would like to rate what they consider their strengths or what they consider is positive about the healthcare concept. And so you can see that it's from a 1 to 5 rating. And so a 4 or a 5, a good or a very good, we consider having a strength. And then the last one is our needs. And so we're asking individuals to tell us if they have any needs around the healthcare concept. So would they like someone to check in with them? Do they want hands-on care? Are they asking for more information and guidance about healthcare and or care coordination? Or they have no needs, so they're able to select any, all, or none. And that's we try to ask the same format of strengths, challenges, and needs for every single concept, all 42 within the application itself. We're able to customize the survey. So for example, some of the projects we've done with Minneapolis, so there are 42 total concepts. And a project we did in 2020, we used 13 of the 42. And those 13 were selected by community. We had community engagement meetings, as Diana had talked about, really having conversations about what are key things that people want to know about that's happening in their community. At that time, it was fall of 2020. So you can imagine thinking back to what was happening in fall of 2020, it was COVID, but also again, giving a shout out to the city of Minneapolis for providing funding for these projects, was looking at COVID-19, but also what was happening around substance use. So we talk about the twindemics, meaning the opioid epidemic, but also COVID at the same time. And so that was a really a front center thing that people really wanted to know about what was happening. And this was a tool, again, in 2020, we were social distanced. We didn't have a vaccine yet at that point. And so we were really trying to figure out how could we get out to community in a safe manner for everybody, maintaining social distancing and also quarantining if we needed to at that time. And so using a virtual community outreach such as a tool like this gave us the ability to be out asking exactly what was happening during that time. I went off on a tangent, sorry. But within our application as well, at the end, when someone is done providing the information within the tool or the survey, they get what's called an individual report. So they're able to get back and see so you can see in the left-hand column where I say I start and put a smiley face, these are their self-reported strengths. So they have strengths in their home, their environment, they have strengths with their connections, their relationships, caretaking, but also they have strengths in moving, hearing, vision, and then also strengths with personal care and medications. And that gives a good indication of a starting point to talk about some of their positive aspects that they have reported, but also looking at where they might have some challenges and needs. So for example, calling out those three that we talked about of housing, COVID-19, and healthcare, saying that there's some challenges around their safe at home and work, that there was maybe potentially violence, that their house needed some repairs, or income, saying that there's maybe too many healthcare bills or that there's not enough income. And then also looking on the far side, the right-hand side, they're pointing out some of those needs that they've reported. So again, looking at it from a community perspective or a clinical perspective, we could really, really identify and I quickly hone in on exactly what are those specific needs that someone has. Again, going down and looking at breathing, that they may it's hard to breathe, or that they have a breathing machine or a cough. Again, very narrow focus, being able to directly target what is happening with someone being able to self-report those challenges and needs. Again, looking at healthcare, they maybe only get care when they're sick, but they'd like someone to check in with them around substance use and or nutrition. That's the self-reported at the very end of the app. Also within the app, we have what's as from the having a license or being able to look at it from a community perspective, we're able to really see what's happening on a broader scale. So we have the option to look at individual reports, but then also on a community level. So for example, each license, they have a dashboard. So for example, you can see the strengths is this green line. So the percentages on this y-axis here. So there's quite a few strengths. Looking at it from the environmental domains across the bottom, as you can see here. So strengths is the green line, the needs are the purple line, and then challenges are this red line or orange line down here. So it provides a way to give a broad viewpoint or a snapshot of what's happening out in the community right at that moment. Again, to bring this data back as we've had to many of our community meetings after we've had some data to say, what does this mean and how can we interpret this for your community or with you for the community. Another dashboard that's available within the app as well. This looks like a big colorful squiggly lines, but really it provides a way to look at strengths across all the concepts that are within the app, but then across quarterly. So we have the ability to look at it not just an individual point in time, but also over time. So as we know, strengths and challenges and needs fluctuate within communities. Specifically the last few years with COVID being up and down, or as we talked about the different variants over time, but also the report around violence or issues within the community obviously fluctuate and trend over time. So able to look at this, and I did a specific call out around healthcare, and we can look at it from over time that is it going up or down, and what does that mean for strengths and challenges and needs within our community over time. This is just another example of what it looks like from the an individual perspective, or a researcher or community having a license at this time. So you're able to download the data. Is yours, and so you can download it at any time to again take a look at what's happening at that specific time. And you can see that we've had from this specific survey, we did a survey over at the state fair this past summer. We had 198 submissions, and just giving an example what the profile might look like. And again, when we have you're able to download the data, there's a big download data button, and it comes as a CSV or an Excel file. And there are a total of 560 data points. It sounds like a lot and it's overwhelming, but it really truly does provide a whole person, whole viewpoint of individual data, but also really looking at it. It's a self-reported tool, being able to look at it for the community. This is an example. I'll pause here and see if Karen Munson would like to add any more details of what we've just described. And we can go into the more details of the project if there's time as well.
The only thing I'd add, Robin, is that the survey is built on a very rigorous terminology that's used broadly in the informatics world, or in what you might call electronic health records. It's been tested for 20 years before it was even published, and it's been used since then for another 30 years. So it's a really strong tool, and that's why we put it in here. It captures all of health and healthcare. And Mr. Clarence Jones was very instrumental in connecting us to community members who could tell us, like Robin said, are these the right words to use in community? Because it was developed for people like nurses and social workers and doctors to document their care. But we wanted to bring it to the people. So that's our contribution to this development of a good data set for community, is to bring this really strong tool to the people so that the people can know what are our real data that captures all of health, all of healthcare, social determinants of health, strengths, as well as challenges and needs. We can understand things like resilience and community compared to all the other challenges and problems that we have because we have this tool.
Great, thank you for adding that. And so this is a project that we did in 2020. I've referenced it just a little bit ago. But again, we had talked about, we really focused on those 13 areas of focus of the all 42 that are in the survey itself. And you can see what these 13 are. And we had students working on this with community as well. And it was quite a few meetings to really decide, to kind of hone in on exactly what we were trying to ask during this time. So in 2020, this is a community-driven, thank you to Clarence and Diana and everybody involved in really being able to be instrumental. Again, I think back to, it seems like a blur now in 2020, but really we were having testing sites, we were socially distanced, everybody, we had no vaccine at that point as well. So it seems like a blur, but it's thinking back to what that was like at that time. So here's some results that we'll just share with you quickly of that project that we did. And so we did ask people how many people they lived with at that time, or what their contact was, just so we could understand some of the movement out in the community. People lived with an average of 3 people, and they interacted with people an average of 4 to 5 people per week. Overall, that they had strengths in an average of the 7 of the 13 concepts that we had talked about. Challenges an average of 8 concepts for a total of about 15 on average. And then needs in an average of the 4 concepts of the total of the 13, and around 6 average needs. And so we did look at, this was a very Minneapolis focused survey, but also we realized that there were others and, filling out the survey as well that we were focusing in Minneapolis, but we had others being able to take the survey that we considered non-Minneapolis. And you can see what that is. Roughly it's almost equal. But most often they were female and then also single. And overall, you can see the strengths of the, up there, sorry, I keep having the screen of everybody's, I have to keep moving it so I can see it. So sorry about that. You can see that there's, of the 13 concepts, you can see that we looked at those from Minneapolis and what we called non-Minneapolis. Overall, an average of around 6.9 strengths. And then people in the Minneapolis zip codes had significantly more strengths than elsewhere. And also within the Minneapolis zip codes, the common strengths were home, spirituality or faith, and also safe at home. And least strengths were sleeping and substance use. Overall challenges, people had an average of around 16.8. And then people in Minneapolis zip codes had significantly fewer challenges than elsewhere. And that our most common challenges were emotions or mental health and sleeping. And that least common were grief and loss, consciousness, and also role change. And overall needs had an average of around 5.8 needs. No differences in needs between Minneapolis and what we were calling elsewhere. Most common problems related to needs somewhat mimicked what were also in the challenges, which is emotions, mental health, substance use, and sleeping, but also grief and loss for needs as well. And the most significant, Minneapolis zip codes had significantly fewer information and guidance needs versus elsewhere. And then we specifically did, because this is the funding we had from City of Minneapolis, that Human and Hawthorne were involved, and they were really wanting to know what was happening around substance use during this time, specifically opioid and also COVID. So we did a little bit of a deep dive within the data looking at the concept substance use. So in Minneapolis, 58.7% had at least one substance use challenge, compared to 82% elsewhere. And Minneapolis had significantly fewer substance use challenges than elsewhere. But we did find that people that had at least one substance use challenge had half as many strengths, 5 times as many challenges, and 4 times as many problems. In addition to that, they had additional 4 times as many needs for twice as many problems. So having at least one substance use challenge really does impact a lot of other aspects of health as well. And we looked at substance use needs for 166 people that were had a specifically mentioned that they had a need in substance use. Care coordination was overwhelmingly the priority. Very few needs for information and guidance, and equally asking for hands-on care and also check-ins. And overall, we did not see differences for Black African Americans living in Minneapolis or elsewhere, and that they had significantly or more strengths than elsewhere. And also, here's a quote from one of our participants within this project, is that Clarence Jones gave us this quote, so thank you, Clarence, is that we just have to help identify where to get resources. And that was again one of the things that came out of this project, is really identifying those key resources that we need to be able to then get and disseminate for the community. And then also a couple other kind of key points was that giving back whole person health data to the community, we found is very useful for starting conversations around policy development and also potentially clinical conversations. And really overall, from this project from the very beginning, we've talked about shifting the paradigm from one of deficits to one of strengths. And so how can we start to shift that conversation, and providing whole person health data that includes strengths gives us the ability to have a platform to start those conversations around looking at it from a strengths perspective versus deficits. Let me one more. And that's it. So I'll pause there and ask Clarence or Diana and Karen also to chime in for additional comments that are things I may have missed, and just overall impressions as well. So thank you again for allowing us to present. And here's our email if you're interested.
Thank you, Robin and Karen and Diana, for that presentation. One of the interesting things about this particular project, it really is this. Okay.
Someone's phone is ringing. If you can mute yourself, please.
Okay.
Mute everybody, please.
Okay. One of the interesting things about this particular project, one of the things that I really love about this project was, first of all, was that our community voice was heard from the very beginning all the way through the process. This process, and what I believe is that in order for us to tell the story about what our community needs, we have to have the narrative as well as those squiggly lines, that other people can explain, and the data, those kinds of things. And so it was very, very important for us to make sure not only that we did the surveys and the community forums, but that we also reported back. And I think the project that Robin is talking about, there was actually a paper written recently that was presented where the community was recognized with that. But we also have pictures. So whenever we do anything, we also ask to have positive proof that the community can see that when we do something, that their voices are being heard. And so for me, this was really a labor of love. I thank again Hawthorne for allowing us to do this. I thank Diana for doing this. But everything that we've ever done in Hawthorne has always been disseminated back to the community. If there was any papers written, we've always recognized the community for it. And every chance that we get a chance to promote someone from the community in this work, or to give them the opportunity to speak someplace or do something, we're going to do that. And that is really designed, again, as a way for us to make our community healthier. That's our win-win. If our community can be healthier. And if people can see themselves as part of the solution, it makes the whole world different. I see Willie and I see Selena. They're also part of Hawthorne. I mean, a part of the Human. But Diane, I'm gonna turn it to you real quick, and then we can let Dr. Monson speak.
Well, I really don't have anything to add no more than I think this was a great project that we took on because it really let the community know that we cared about them, that we were asking their opinion. We weren't just putting something out there. We wanted to know what was it that you really needed, and they told us. So I'm grateful for that. And I mean, it was a lot of work, but at the same time, I look at the fact we did it, and I give all praise and thanks really to the community, because without them, we couldn't have done this.
Right.
Miss Robin?
I'll just chime in and add my sincere gratitude and appreciation for this partnership. You know, I've been a public health nurse since 1980. So I'm back in my happy place where I have my boots on the ground and my arms around my colleagues. Arm in arm, we're working together and letting the community have a voice. And that is what this is about for me, is if I have an opportunity to be an ally and to let the community have a voice, that's where my heart is. So this was the data that we shared was really the first experiment in Minneapolis. How can we, and thanks again to City of Minneapolis for making it possible for us to do this together. Those $10 incentives for completing the survey made magic happen. This was only the first. We've had many more surveys since this. So many more communities are interested, many more partners, many more languages. And the beauty of it is scalable, it's free, and the only thing, you know, you get a tiny bit of funding that lets us collect some surveys, and the community gets, it's like jet fuel. It's like, okay, we just bought you some data that is going to take you places, and you decide where you want to go. So, thanks again.
Clarence, I have a question.
Sure.
Does anybody have any questions though before we go? We really would like to hear what people thought of this presentation. Did it help you? Did you get any information off of it? Something you would be interested in? So you can just either raise your hand or speak out. Okay, Clarence, what were you going to say?
Well, what I was going to say was the fact that one of the things that came out of this particular survey during this period of time was that sleep and relationships were important to our community. And we saw the connection between the lack of sleep and the use of substance abuse. That people, because they couldn't sleep, but they didn't have good relationships. I always make this, I shouldn't say it's a joke, but I always talk about what was it like being in a one-bedroom apartment with 4 or 5 kids, you know, when they couldn't go out and they couldn't play. You know, what did you do in order to support yourself during that period of time? And it's not a joke, but it is, but it's a reality but many people were in that kind of situation. And so we saw this increase in substance abuse and death. And so it gave us the opportunity to talk about sleep and how to get more sleep, how to develop more relationships, how to find resources to support you. I mean, those were important for us. I mean, we didn't have to go searching or trying to find some magical thing. We knew what to do. And so it was important, again, to have this information so that we could make some informed decisions about our work. And so with that, we had our other community partners who were able to assist us because they knew exactly what the community was asking for. So that's what I had to say. Anybody else have anything to say before we move on? If you have any real questions, you can ask Diana. Okay, so.
I just love the way you just keep saying ask me.
I'm just going to highlight that in the chat, Sandra Camp from Hennepin County says that this is amazing and very helpful. Hennepin County Child and Teen Checkups is working on similar survey when we do in-person community outreach. Thank you. So that might be a nice connection to make as well. Just wanted to let people know.
Yep.
Thank you, Sandra. Well, Clarence, should we move on?
Yes, ma'am. Go ahead. Your turn.
Well, we have many announcements to make today, so I'm hoping everybody has their piece of paper and pencil so you can write down all the good stuff. I'm going to go last. So, Mr. Adam, where are you? Oh, there you are. I'm going to let you go first.
Oh, thank you so much, Diana. Yeah, and thank you to everyone for the opportunity to speak, and also to hear about the important work with what you just shared, Robin, and Karen, and Diana, and Clarence. It was really important to provide some context around, what people are facing. And, I'm with the Mississippi Watershed Management Organization. I don't know if folks are familiar, but we're a watershed district that works within North and Northeast Minneapolis. And, we're probably more on the physical environment side of that stuff, but, all of it plays a role. And so we're really interested in getting people outside and, interacting with the river and thinking about the environment. I did want to announce that for those of you who knew Michaela she was the youth community outreach specialist here. She has moved on to a different role with a group called Green Minneapolis. So she's still around. She's still doing really important work and is supporting youth through her new job, hopefully. And we're still going to be supporting the Minneapolis Green Team, which is an opportunity for youth from North and Northeast Minneapolis to get out during the summer and do some outdoor oriented work and some learning around environmental topics and stuff like that. So we're still doing that, and we're trying to figure out how to fill her considerable shoes. She was a really strong advocate for youth in the area, and she will certainly be missed. So if you do have any questions about how to connect with our group, you can reach out to me. I'll put my email in here right now. And one other thing that, is kind of maybe on the more fun side, if folks are thinking about warmer days from now, we have an opportunity for folks to get out and learn about birds that use the Mississippi River as their home. And we're partnering with Dudley Edmondson and really trying to get folks from the local community to come out to that as well. So it's family friendly. It's at North Mississippi Regional Park, the Nature Center. And Dudley is a really experienced and super impactful person who's done a lot of work with photography and filmmaking. Wrote the book Black and Brown Faces in America's Wild Places, and has really been kind of a great conduit for getting people to natural spaces and to sort of get that healing power of the natural world in their lives. So if you're interested, please feel free to join us. And yeah, that's all I got for folks. Thank you.
Thank you, Adam. Thank you very much. Ms. Ann, you're up to tell us about Step Up.
Morning. Hi, everyone. My name is Marian Sharif Upton is here, and I am the new Step Up Level 1 manager here at the City of Minneapolis. Step Up season is just right around the corner, and as of right now, we are still taking, we're still recruiting employers, sort of kind of wrapping that up in the next month. Step Up, and as many of you know, and I know some of you were key in the creation of Step Up many years ago, but serves the level 1 component of the program serves 14 to 15-year-olds. On average, it's a 9-week program. Youth work 20 hours a week at $12.75. And we really try to push the mentorship aspect at level 1. And so it being the first, adult experience that they have and job experience. This year, we're really, really excited because we're bringing back placement days in May. So they're going to be in person. We have a couple of really fun things happening. We are doing more of a marketing and branding around Step Up placement days in May. And so we're going to have a fun experience where youth get to come and have this little passport to a job and go through all these little stations. They're going to have the opportunity to have a headshot. And then we're going to have some financial institutions, credit unions, and other community partners talk about financial literacy. So as of right now, youth are going through training, but we are also looking for volunteers. So I'll put in the chat a sign up a smart sheet link, but we're looking for volunteers for 3 placement days, and then we have an additional day in June, kind of a makeup day for those youth that didn't get an opportunity to place in May. We're looking for volunteers, everything from greeting youth at the door to filling the stations to doing mock interviews. It's going to be a fun time, and I really can't wait. I know 2 years of being virtual, and then with the strike and a lot of the uncertainty has really impacted our young people, and they're so resilient. So I'm really, really excited that we're going to be in person. Going to have all the Step Up colors, and please come out if you have the opportunity or the capacity or the time. Come volunteer with us, and we hope to see you in May. And please get the word out. We are still taking pledges for employers. We are wrapping up though, so they have about the next 2 weeks to make a pledge, and I'll put my contact information in the chat as well.
Thank you very much. Ms. Cow from Minneapolis Climate Action.
Good morning. Excuse me, everyone. I haven't talked much this morning. Wow. I have a bit of a sore throat. It's not COVID. I've gotten tested twice. Anyway, I am Kyle Samajima. I'm the executive director of Minneapolis Climate Action, which is a local nonprofit focused on equitable local climate solutions. And I want to thank Diana for inviting me back to Hawthorne Huddle. I love being here, and to Al McFarlane for having Christelle Porter from MN Renewable Now, Northside Climate Organization, on a show last week to talk about, our I want to highlight first that we're in a climate crisis. Our city has declared a climate emergency. We hear this depressing news all the time. We hear about the disparate impacts of climate effects that are happening right here and the effects of pollution in Minneapolis, and how the impacts that are hitting communities, of course, at different levels. But the exciting thing is that right now, North Minneapolis is the center of some of the most exciting climate solutions, I think, out there. And I will talk about two of them quickly. One is, I'm going to share my screen quickly, just because if it's disabled right now, I'm just a visual learner, so I know that seeing these things is can I share my screen, or?
I'll make you co-host. I'm working here right now to get that for you.
Thank you. And as we, I just want to reiterate too, that I could not do this work without community partners and the relationships. It's what sustains me personally and professionally. So I want to thank, everyone here for the work that they do. Yeah,
there you go.
Awesome. Thank you. Let me get the right screen up here. Can you see the solar panels? Just want to make sure I have the right screen up.
Yes.
Awesome. Yes. So these are 900 solar panels that are on the roof of North High School. And they are not just solar panels for the school, they are solar panels for the community. We have created a community solar garden model that is barrier-free, that community members can own some of this renewable energy, and Excel has to pay them for it. This project is also, these are some of the students from North High, and Jemez Staples, who runs Renewable Energy Partners on the north side, is our solar developer, one of the only Black solar developers in Minnesota. And JT Thomas runs Go Solar Construction, and he is our installer. So these are people at the center of local climate solutions. We are having an informational session next Thursday, April 14th. I put the Facebook event in the chat. It's at Liberty's Northside Healing Space. This is a chance to come learn how community members can be a part of the renewable energy revolution, but also benefit financially. People can join this garden with no money down. We don't check credit score or income. You can rent or own. And we really want North High and North Minneapolis families to be first in line to sign up for this garden. We could fill it with people from, Edina and Bloomington yesterday. And we aren't doing that. We are absolutely committed to making sure that this is a local solution. We are doing this work again in partnership with Hawthorne. Thanks again to Diana, with Al McFarlane. We're working with Sabathany on the south side and Kendo and Central for a community solar garden down there. So again, we are really excited about these climate solutions that really not only reduce greenhouse gas emissions, which is critical, but get to the heart of how we got here in the first place and healing those systems. We really have to look at the extractive capitalism and the inequities, the systemic racism, and the environmental injustice to get at the heart of these issues and create solutions that don't just perpetuate the same toxic systems. Again, we do this work in partnership and couldn't do it any other way. I also want to share, I'll share a document. Jamez Staples, who you saw earlier, has had to work really hard against huge waves of resistance and just flat out racism to get a renewable energy job training center started on the north side. Right now, they are starting training, and there's actually, it's probably one of the most exciting and innovative renewable energy kind of innovation centers in the country. You know, there's battery storage and solar and again, really getting down to the job training. I'll share the job training thing that's coming up. Again, please share this information with your networks. It's in the chat. I put my contact info, and I'll share the job training session that is coming up as well. And again, thanks to everyone for their partnership and all their work on healthy communities.
Ms. Tasca, thank you, Cal.
Good morning, everyone. I'm Tasca Welters with Department of Corrections and Rehabilitation. So this morning, I just want to make an announcement that we are the Department of Corrections Community Corrections Coalition. So this is an advisory group that advises the director, Catherine Johnson, on issues. They have direct contact. She actually serves as the co-chair, and now we do have a community co-chair now in place, Timothy Sayon, who is from the North Minneapolis area, resides in the North Minneapolis area.
You're muted, Tasca. You're muted, Tasca. You're on mute.
I'm talking to myself this morning. I'm still partially asleep. Yeah, so again, I'm Tasca Welters from from the Department of Corrections, and we are recruiting for the Department of Corrections Community Corrections Coalition. So this is an advisory group to our department director. And so I have my information in here.
She's muted again. Not sure why you keep going on mute, Tasca, but put the information in the chat.
That's what I will do, because
Okay.
I just can't seem to get it right this morning.
That's okay.
But if you are interested in joining our corrections coalition, and I'll keep talking about it every month. So
okay, I appreciate that. Yeah. Okay, before I turn it back over to Clarence, and before I make the last announcements, does anyone else have any announcements? We're on good time, you guys. You know, I like to make sure we're out on time because people got to get to work. So
I have one.
Yes, ma'am.
Can you hear me?
Yep, we can hear you.
Great. This is Doris Baylor again, and I just wanted to invite all of you to the groundbreaking we're having for the Satori Apartments on Broadway. It's the first phase. We've started demolition, and it's going to be on Thursday, May 12th at 10 o'clock. It will be the first of what we hope many positive developments happening on Broadway. It is the beginning, it's the corridor, it's the main street for our community. And so it's so important that we continue to reinvest in that visual and vision for our community. And so I hope all of you will attend, and I will send the information on the chat as well.
Thank you, Doris.
Thank you.
Anyone else? Mr. Willie, you're kind of quiet today. You always have an announcement.
No, it's sometimes you just got to listen. But I thank you for that. It's good seeing everyone.
Yeah. Does anyone else have anything? Okay.
Diane, I just want to bring something full circle here.
Yes, ma'am.
Jamez Staples, who's been with us before, we should bring him back again. Jamez reached out to LaToya when he was first doing the work that he was doing to ensure that young people had a voice in what he was creating. And she helped him do that. And really, I think, got some very good information and input from the Minneapolis Youth Congress. So I just want to bring that around again to just show a little bit of what can happen.
I think when we do our huddle that's going to feature Cal and Christelle, we should invite them then. How about that? Because we're going to have a segment with them. Okay. Does anybody else have anything before I make my final announcements? Well, as everyone knows, Earth Day is coming up, so we want to support that. The state of Minnesota, you're able to get free COVID testing kits sent to you. And then the presentation that you saw today is going to happen again on April the 22nd at the coalition meeting. And so I invite you to, everyone to attend these 3 events if you can. Mr. Clarence, I think I will turn it back over to you to wrap it up, but I want to say thank you, everyone. Oh, Mr. Sam Simmons, he's okay. Now, we only got a few minutes, Clarence, remember, so keep the clock on this one, okay?
Is Sam to speak? Okay.
Wow. Wow.
We love you, Sam.
Yeah, okay. I just wanted to just put this out. We are going to have the Community Empowerment through Black Men Healing Conference this year, but we're working on it being in September 22nd, 23rd, because we went on and planned it for virtual because things are still up in the air. And so we didn't want to have to try to bounce back and forth for in person. So we figured if we have it later in the year, people be more ready after they get to doing their vacations to want to be involved. The theme this year is, how does the community heal when it feels like it's under attack? And so we're going to look at external and internal issues that the community is dealing with around trauma and safety. So you'll be getting more information on that over the next month or so. Thank you.
Great. So first of all, I want to thank all of our presenters for the information that they share with our community. I want to special recognition to all those who were honored. You are appreciated, you are valued, and you are important for us as a community. I want to thank all of you for spending your early morning time time with us, and we look forward to seeing you again at our next Hawthorne meeting. So thank you, and have a great day.
Thank you, you too.
Thank you, everybody.